Hey there, let's talk about your knees. I mean, think about it. Whether you're climbing stairs, chasing your kids, or just walking around the house, they're involved in pretty much everything you do. But most of us, we totally take them for granted until they start making noise. So today, we're going to put together a user's guide for your knees, designed to keep you moving and moving well for life.
You know the sound, right? You stand up from your desk, or maybe you crouch down to pick something up, and click. Sometimes it's nothing to worry about. But other times, that little click is your body trying to send you a message. So the big question is, what is it actually trying to tell you? Let's figure that out.
To really get a handle on this, we're going to look at the entire journey of knee health. We're drawing on some heavy hitters here, like the CDC and the American Academy of Orthopedic Surgeons, to guide us. We'll start with prevention, the best-case scenario, then move on to what to do when an injury happens, and finally, how to manage things for the long haul.
All right, so let's start with the most important part, honestly, prevention. The goal here is to build knees that are resilient. This isn't about waiting for pain and then reacting. Nope, this is all about being proactive and setting up a strong foundation so that problems don't even get a chance to start.
When you really boil it down, it comes down to these three pillars, and they are huge. First up, managing your weight. This is an absolute game changer. Get this, for every extra pound of body weight you carry, your knees feel 4 pounds of extra pressure. That adds up incredibly fast. Then there's building up the muscles around the knee, your quads, your hamstrings. Think of them as your knee's personal bodyguards. And finally, moving smartly and consistently. That's what keeps the joint lubricated and happy.
Okay, so what does smart movement actually look like? Well, on the left, you've got activities the CDC basically gives a big thumbs up to. Things like swimming, cycling, they're amazing because you get all the strengthening benefits without pounding on the joint. Now look at the right side. This stuff isn't necessarily bad, but you have to approach it with care. Running on hard pavement or doing really high-impact sports puts a ton of stress on your knees, so your form has to be perfect, and you just have to be smart about it.
But look, let's be realistic. Even with the best preparation in the world, injuries can still happen. So what do you do in that uh-oh moment when something goes wrong? Knowing what to do right then and there can make a massive difference in how well you recover.
Acting fast is everything here. The second you feel that tweak or pain, just stop. Don't push through it. Your #1 job is to protect that joint from any more harm. After that, it's all about the classic RICE method. You know, rest, which you're already doing by stopping. Then ice, for about 15-20 minutes at a time to keep swelling down. C is for compression, wrapping it with a bandage. And E is for elevation. Get that leg up higher than your heart. Seriously, these simple steps can change the entire course of your recovery.
I absolutely love this quote from the American Academy of Orthopedic Surgeons. They say ignoring that pop or that feeling like your knee's going to give out is just like ignoring your car's check engine light. It's not a suggestion, it's a clear warning that you need to get it checked out by a professional.
Now pay really close attention to this, because these are the absolute deal breakers. These are the red flags. If you hear or feel a pop, if you literally can't put weight on that leg, if the knee feels wobbly or just gives way, or if you have really bad pain and swelling, or you can see that it looks different, that's not a wait-and-see situation. That is a get medical help right away situation.
Okay, but what if the pain isn't from one big, sudden injury? For a lot of folks, knee health is more of a long-term management project, dealing with things like arthritis. And here, the game plan shifts. It's less about a quick fix and more about finding sustainable, long-term strategies to feel and move better.
So one of the tools you might come across is something called a TENS unit. It sounds super technical, but the idea is actually pretty simple. It's this little device that sends a mild electrical current through your skin. That current basically scrambles the pain signals that are trying to travel up your nerves to your brain. It's a really interesting non-drug option for managing pain.
And that's the key, right? It's not about finding one single magic bullet. It's about building your own personal pain management toolbox. You can see here you've got different tools for different jobs. Physical activity is amazing for overall stiffness. A TENS unit might be perfect for targeting a specific spot of pain. And of course, weight management is that foundational tool that reduces the overall stress on the system. The trick is finding the combination of tools that works for you.
All right, let's bring it all home. We have gone through a lot, from laying that strong foundation all the way to handling the challenges that pop up. So let's just boil it all down into a super clear, actionable plan that you can use starting today.
Here it is, your 4-step action plan. #1, always prioritize prevention. It's the best medicine there is. #2, get really good at listening to what your body is telling you, especially those red flags. 3,
Don't ever be afraid to get an expert opinion when you need it. And finally, number 4, empower yourself. Build that personal pain management toolbox that keeps you in the game.
When you think about it, our knees are just incredible. They are literally built to carry us through the journey of our entire life. So, after all this, the question isn't for me, it's for you. How are you going to prepare for your journey? What's one thing you can do to get ready for the road ahead?